Hi everyone and welcome to Season 2 of the Leading Beyond the Lab podcast, proudly sponsored by ARTO, the competitive edge for life sciences talent. I'm your host, Lawrence Rose, and our mission is to shine a light for aspiring scientists and physicians looking to understand what life's really like in the pharmaceutical sector. In each episode, we dive into the stories, insights, and valuable lessons learned that have propelled our guests to remarkable success and impact within their respective disease areas. Now, if you enjoy listening to this episode as much as I enjoyed recording it, be sure to hit subscribe because we'll be releasing new episodes each week. Welcome, Volker, to the podcast.
Thanks for having me, Lawrence.
How are you finding AAD?
Busy.
Have you got any moisturizers and things stored away?
Not yet, but don't tell my wife. Not yet, no.
So it's an opening tradition on the podcast that the guest would basically give a quick overview of their experience and where they are in their career.
Okay, fantastic. So, Lawrence, my name is Volker Koscielny. You know, as you can hear, I'm German. Yeah. I'm a physician by trade.
Living in Spain.
Living in Barcelona now, working for a mid-sized pharmaceutical company, Almirall, dedicated to dermatology. I've been in the industry for over 20 years. You know, I'm a physician by trade, trained at the University of Berlin, the Freie University. And then started my career in the industry, slightly unusual, in South Africa as a sales rep. You know,
oh, really?
We can talk about that a little bit more. Moved around various countries, as many of us in the industry do, and for the last 5 years in Spain.
So how did you go from MD to sales rep in South Africa?
Well, believe it or not, I'm for German, but the reasons were romantic. I followed my wife to South Africa. And it was difficult to work as a doctor. I tried to work in South Africa in those days, and I got an offer to work in the industry as a sales rep. The company I started with, they had a policy of everybody has to carry the bag. So, to be honest, it was a fantastic experience. You know, I worked all over South Africa and Namibia. Very
a nice place.
Yeah, fantastic, wonderful people. Very humbling experience. You know, you're a freshly qualified doctor. You know, you have a certain ego, and here you come in as a sales rep. You know, very humbling experience, but important. I can really recommend that for everybody wanting to start in the industry.
Did it give you an edge when you were as a sales rep?
I think it gave me an edge later on in positions because I could always relate to the commercial teams. You know, I loved going to sales conferences. I could speak their language. I felt their pain. I could see how, you know, the lonely hours on the road, you know, the disappointment, not seeing doctors, customers. So I found it easier to relate to them. So I felt it gave me an edge.
Yeah, I think now most of the medical affairs roles that we work on, there's some form of transformation where they're trying to align medical affairs and the commercial functions more together.
Oh, yeah.
So you're kind of ahead of the curve there.
Oh, yeah, absolutely. And, you know, in the olden days, we used to speak about, you know, when you went to commercial, it was about you're going to the dark side. You know? I think that is utterly nonsense. There is only one way of working, and that's ethical, whether you're on a commercial side or you're on the medical side. You know, obviously, technically, there's certain things you can't do in the commercial field, but the purpose that we're serving here should be the same for everybody. Must be the same.
So what's unique to you, Volker, is that your reason for going to the industry is a romantic one because it was driven by the relocation.
Well, it was a romantic one initially, and then the more I learned about the industry, I went back to medicine afterwards. You know, I worked in the NHS actually in the UK. As a doctor, but I actually liked the industry. I liked the creativity. I liked the diversity. I liked the commercial element, you know, and I liked the collaboration with top academic centers in advancing medicines.
Mm. And what's been your biggest challenges when you first went into industry, do you think?
I think understanding the complexity, understanding the different functions, understanding the different perspectives. You see, if you work in a hospital, you know, you carry a certain responsibility as a doctor. Of course, there is a team, there's a cross-functional team taking care of patients, but in many ways, the buck stops with you as a doctor. And when you make the transition to the industry, you have to learn different perspectives. You need to really understand where people are coming from and bring it all together.
Yeah. And what about the transition from big pharma to mid pharma in different companies?
Yeah, I worked in big pharma. I worked in smaller companies, in biotech companies, and I would say that in big pharma you play a certain role. You have a lot of resources of your disposal. In a smaller company, it's a little bit you have to do everything. You know, changing the light bulbs and doing everything. Personally, I enjoy more. Yeah.
Yeah. I think that there definitely is often a trend where candidates, they're in big pharma for a long time and they just get to an inflection point in their career where they just want to try something new. Yeah. They want to sit next to the CEO, the head of quality, other people in different departments, talk different languages, learn different things, and be hands-on. And I think a good example of that is I remember placing a CMO, and his first day I called them halfway through the day, and I said, "Oh, how's it going?" And they said, "Oh, it's okay." I was like, "Well, what do you mean?" He said, "Well, look, it's a biotech CMO role. I've been fixing my computer. I've been trying to get my computer installed for 4 hours."
Yeah. And that's it. That's it.
Yeah.
So it depends what kind of person you are. It depends on your personality.
Yeah.
I mean, for me, the transition into mid-sized pharma, into biotech was an incredibly rewarding transformation. And you're challenged in many different ways, and it's a constant learning curve, which is fantastic. But of course, that's what you need to want.
And what personality traits do you think make, in your opinion and experience, a very good drug developer?
I think the first thing I would say is humility. You can't be arrogant, because this is you need to listen to the experts, and then decisiveness.
When you say experts, do you mean within the company, KOLs?
KOLs within the company. There are always people, even if you're a brilliant scientist, there are always people who are smarter than you. And there's no substitute for really deep subject matter expertise. Yeah. And you need to have the humility to listen, to learn. And then you need to apply judgment, wisdom, in making good judgment, and you need to be decisive. And that means sometimes disappointing people, particularly when you work with academia. These are people who are incredibly dedicated to patient care, to advancing scientific understanding. And it is very, very difficult to disappoint them, because your resources are finite. You only have a limited budget, and you need to apply it to the best of the project, and that's difficult. Yeah, so humility, judgment, and decisiveness, I would say.
You've almost got to be an empath. I just think of the thought of an academic who's living and breathing this molecule, and then they get told that it's no longer going to be developed for X, Y, Z reason.
Yeah, that's tough. Yeah. That's tough, and you have to do it with empathy, and you need to do it with support, and those are difficult conversations. Disappointing people who have committed many, many years of their lives to certain programs.
And how have you seen leadership develop in terms of what you've been around? It's good leadership when you compare it to, you say you've been in the industry 20 years, GSK, big pharma, mid pharma. How have you seen good leadership develop?
I'm not sure. I've seen different styles over time. So I come from an academic medical setting in Germany, which in those days was very, very hierarchical. So you had to earn your place. You had to suffer first, and then you maybe sacrifice, and I think that has changed in an academic setting. In the industry, there was a little bit of that in the early days. And then again, the cultural context is very important. Whether you work in the US or in the UK or in France, where I've worked, or Spain, I think in some countries there's more of a hierarchical approach. Top down. I think if you move to biotech, smaller companies, you have much more of a shared approach. A much more collaborative approach. So there are differences. I've seen that early on in my career. I still see it later on in my career. So I'm not sure there is an evolution, even if we want to believe that we're much more collegial, much more soft, much more shared, and
Yeah, it's funny, isn't it? Because you think leadership must be one of the most studied topics. Now we're talking about it in thousands of years. There's been books written on it. And still, we're still doing it, right? I still read leadership books that are new, know. And you're still evolving, I suppose you just try and take little nuggets of information or best practice.
And look, different things work. There is no one answer. I've seen, companies run by a bunch of ex-Marines. Really, really tough. incredibly efficient. I've seen companies being, run on consensus. Both work, If at the end of the day, if you have a common culture shared by everybody, if everybody buys into that specific culture, and if people, are aligned on purpose, things, different styles work.
I suppose one thing's for sure, you've got to be authentic, haven't you?
Yes, exactly.
People are good at sussing that out.
That's a key word. Yeah. That's a key word. You're absolutely right. And I think that makes all the difference. Whatever you are, you have to be authentic.
Yeah, you can polish, but you can't change.
Exactly. No, Lawrence, that's a really good call.
And so when you look at new opportunities, new companies, what sort of things inspire you and other drug development professionals, do you think?
I think what inspires me if people are driven by a clear purpose,
of the company,
of the company, and I think it has to be, for me at least, and for many of my colleagues, it has to be focused on solving a problem for patients. Identifying a clear unmet need and making a clear contribution with a purpose of making a difference. And those are often the companies that are most successful. So that's a starting point, and for me, that's non-negotiable. Yeah.
I suppose Almirall is a good example of that, aren't they? Because they're in an interesting field right now in dermatology. Yeah. There's lots and lots of investment, a ton of interest. Yeah. Biotechs as well, and even Barcelona, where you're based. Yeah, that's
no, Lawrence, it's a great point, and if we want to talk about dermatology a little bit, there has been, of course, as you know, in the past, a lot of focus on oncology, a lot of focus on immunoinflammation. Dermatology, I think in the last couple of years, is coming a little bit more in focus. And I think it poses bigger questions to us as society. Dermatology, not always perceived as really serious, perceived as really cosmetic. But if you work, but if you work in the field, it is the impact dermatological diseases have on patients, on any of us. Ask any teenager with severe acne in an age of social media. The impact is profound.
Mental health,
on mental health, on confidence, and what is the impact of that long term on academic performance, on it changes your life trajectory. So it's fascinating. It's a fascinating topic, and you have to ask, what are we prepared to fund as society, to pay for? Do we want to prolong at any costs life end stage? Most of the costs we pay, healthcare systems go in the last couple of years, even months. And yet we skimp around, to fund modern innovative therapies for some of the dermatological diseases that are perceived as cosmetic, but the impact on patients can be profound.
Yeah, it almost brings in the obesity rise, doesn't it?
Absolutely.
Yeah, because we do a lot of work with Eli Lilly, and it's a fascinating molecule, no doubt it's making a massive impact. Yeah. And it will probably, I imagine, reduce healthcare costs exponentially.
Absolutely.
And probably other illnesses around that, right?
Absolutely.
That could be like diabetes or whatever that can come after.
No, one of the things at the moment in my company, I'm overseeing market access and pricing, which is maybe for a chief medical officer also not that usual, but I agree, I find it fascinating, because I think where we need to get to is to see healthcare, to see medicines, the contribution we make in a more holistic way. It's not only the clinical outcomes, but it's also the economic impact. To your point, Lawrence, it's the economic impact that we need to describe.
Yeah, it's all part of the same ecosystem.
Exactly. Yeah, again, we can't separate it, and that's one of the things that fascinates me most at the moment. Yeah.
I find it fascinating how the commercial element stayed present in your career, because it's hard to find CMO roles that have a commercial element. But they all say we'd love them to have commercial expertise or understanding, because they can think with the end in mind. Yeah, how do you actually get drugs marketed?
Yeah, and I think it also brings me back to my days as a clinician, because ultimately you want to make a difference. You want to somehow bring meaningful value. And the commercial success, the sales, the numbers, for me is just a reflection of the impact your medicines can have. It's a way of keeping score somehow, how much you can make a meaningful contribution, really.
And what do you think the future's like for dermatology then?
I think it's bright. I think there are many diseases that we start to understand better. If you look at some of the diseases that have been neglected for decades for many is a disease called hidradenitis suppurativa, which is a very severe form of acne in your axilla region and so on. Patients really, really suffer. There's a huge effort now on bringing modern breakthrough therapies to this area. This has been neglected for many, many years. So I think we're starting to understand these diseases better and put the effort behind it. Yeah.
It's reminded me of a point that Brian Kim said on a previous podcast. He said that when he first started in dermatology, when he was specialised or focusing on atopic dermatitis, he was laughed at and told, you won't make any money, there was no impact, you won't really help people. And then, and fast forward, however many years, it's the main indication within derm that everyone's focusing on. So it's just fascinating to see how things can evolve and opinions can develop.
Absolutely. And I think once a field gets traction, gets focus, look, in dermatology, we're only scratching the surface. So you may have 8, 10 larger indications that the industry is focusing on at the moment, but then you have over 600 rare diseases. So if you pull that patient number together, it's a significant number of people out there today that are completely underserved. So the opportunity, conversely, for research, for developing medicines, products, innovative approaches is enormous.
And when you consider scientists, physicians in industry, either working in pharma or biotech and haven't crisscrossed into the other side, the dark or the light side, as you like to put it, what would be what are the behaviours that are consistent across both that you need to be successful and to build a good career? And what are the behaviours or traits about your personality type that need to vary based on whether it's a small dynamic biotech or a large pharma?
I think that there are two things. The one common trait you need is a degree of flexibility. And that is because in both, because look, these are passionate projects. You find passionate people. You find people that are incredibly dedicated, and it is sometimes difficult to take a step back, and see the perspective from other departments. For example, a common scenario is, I have my project or I collaborate with an academic institution and I don't have the funding anymore. The corporation has decided to cut your funding.
Stress there.
Stress there.
Last year.
And you have people throwing a tantrum, not making peace with it. There is a degree of realism or flexibility that you need and finding a way. And that links to the second piece is resilience. You really need resilience in both. I think maybe more so even in smaller organizations. Because you have to find a way somehow. In a bigger organization, that probably suits you better when you want to feel safe. You want to feel safe in the knowledge the resources are there. You're looked after. I have my defined area of expertise, my defined area of responsibility. It depends really on the personality that you are. And there's no right or wrong, It's
no, I agree. There is no right or wrong, is there?
There's no. And I think for people wanting to enter the industry, self-awareness, understanding yourself, understanding who you are, what gets you a kick, and what are the things that you're not comfortable with necessarily or don't want to go, should really help you to determine which kind of organization where you start.
It's amazing how many more physicians are already aware of potentially going into the industry when they start medical practice, whereas 10, 20 years ago, I imagine that was non-existent.
No, that's true. That's true. And I think in that sense, this dark side that I spoke about, I think there's much more of an understanding and maybe even appreciation of the industry, because look, what I learned is you find incredibly dedicated people in the industry, incredibly dedicated scientists, very, very capable, and the best projects are really wonderful co-creation, collaboration between academia, between clinicians and industry experts. Bringing their own area of expertise, and then magic happens.
It's like Steve Jobs. A players thrive whenever other A players, right?
Exactly.
I can see how that's quite the energy must come off that environment when great minds are coming together and bouncing off each other.
And those are the things that I love. And coming back to your first question, at the AAD, those are the discussions we're having here. And that still gives me really a kick. And, it's incredibly rewarding to be part of these discussions and develop ideas and be creative and hopefully down the line bring solutions to patients.
With that, something that would be really insightful that I've never thought about before is when you're having these kind of round tables where everyone's bouncing off of each other, I'm assuming that sometimes within those environments, other pharmaceutical companies are also there.
Yeah.
So does that get competitive, or do you bounce? How does that work? Is
There
it like an underhand kind of awkwardness? I don't know.
There are initiatives where we need to collaborate.
Yeah.
So the real, like big registry initiatives where, let's say, you're dedicated to the greater good of describing the burden of a disease and so on, where there is no competitive, element, where you just collaborate because it's to the greater good. And then, of course, when it comes to specific targets, molecules, things that you want to develop for your organization, then there is a competitiveness there.
Yeah.
So it really, really depends.
It's really interesting, isn't it?
Yeah.
And what about, so Almirall is a privately owned company, family?
It's a listed company, but a majority of privately owned.
Yeah. So does that help when you want to get things done in terms of top-down instruction, vision, clarity? Whereas I know that some of the feedback we get sometimes with large pharmas is it can be, bureaucratic or, the misalignment.
Yes. No, a small organization, I mean, certainly what you can achieve, ideally, and I think we live this in Barcelona, in Almirall, is very, very short ways, very quick decisions, and that makes a huge difference. Actually getting a contract signed quickly. I can pick up the phone to the CEO and owner of the company, and we can get a decision very, very quickly. In
some ways, it's the best of both, because you've kind of got there's no risk because you've got the commercialized products, and it's still a substantial mid-sized pharma.
Exactly.
But you've also got the dynamism that you kind of sometimes want.
Yeah, and the beauty of a, let's say, family-owned company is you can take a more of a long-term vision. Yeah, you're not held hostage necessarily to the shareholders, to some degree, but you can allow yourself to take a little bit more of a longer term strategic vision.
Yeah, well, you're not worried about what investors are constantly thinking, which is definitely a massive consideration for most CEOs in biotech.
That's a huge. Of course, we are. We have shareholders. We're worried about this. We want to be responsible, but there is an element of a longer term perspective.
There's not this limiting runway, with 6 months left, where you've got to kind of figure out how to expand it and things like that.
Exactly.
Which is it just takes time away from other things. I suppose that's the key.
Yeah.
And so what do you say, in your opinion and from your experience, what do you think is probably the most fulfilling, or what moment stands out where you really felt that you had a massive achievement and it sticks with you today?
No, I described the scenario when we brainstormed and came up with ideas for new molecules, for new medicines. But look, one of the things that I'm also very proud of is what we call real world evidence. So you bring a product, a medicine to the market, fulfilling regulatory needs. These are very formalistic studies, and they need to be like this, so phase 3 studies. But then what you really need to understand is what is the product doing in a real world setting. And that is also becoming increasing, and that may be very different because the population that you give the medicine to is completely different or oftentimes completely different to what you have in your phase 3 studies. So the proof is in the pudding there. So describing in the real world, generating real world evidence is becoming increasingly important. That's something we're doing really well. That's something I think is important. And also we spoke about the economic value. That goes hand in hand with it, demonstrating that the product doesn't really only bring value to the patient, but also to the healthcare system and society. Yeah, we have worked a lot on this, and we have pioneered a lot of work. So, for instance, we have in psoriasis for the first time we have used well-being as a primary outcome. Not only improving the quality of life of a patient, but asking a more fundamental question: can we truly give patients their lives back?
What do you mean by well-being?
Well-being means
or how does it differ,
the World Health Organization has defined it. They have 5 questions, where they measure basically the psychological and physiological well-being of a patient. And
so it's not whether you can walk again. It's
more.
No. How are you managing things mentally?
It's managing your mental health, your energy, your happiness, and and then you can compare that with a normal population, and it's fascinating work. So for example, psoriasis, we know now today that severe psoriasis, in terms of the impact on patients, it's the same level as breast cancer.
Oh wow!
Yeah, or severe depression. And we know when we treat these patients appropriately, we can bring them back to an almost normal state. That's remarkable.
Yeah.
So that kind of work, sorry, long-winded
it's
answer to your question,
but
that's fascinating. The impact that you can make and measure it and demonstrate it.
Yeah, and you've been quite adaptive, haven't you? You've not just worked in dermatology, but it's across different therapeutic areas.
Yeah. As many of us in the industry, you move around with developments in life cycle, and I think that also is important and has been really, really rewarding. So I've worked in rheumatology and in cardiovascular medicine, psychiatry, different areas, and you learn in every area, and at some point bring it all together.
Yeah, and I suppose you've enjoyed being in Barcelona with great food, wine, and sun.
Oh yeah, I can't complain.
You take up surfing or anything?
I'm too tall. You can't see this here, but you don't want to see me on a surfboard.
Yeah.
No, that's not a good look.
Baby giraffe.
Yeah.
Well, that brings us to a nice natural close, I think, in terms of the podcast. It's been really insightful and a really interesting insight into your experience and the challenges, and super inspiring to the listeners, I think.
Fantastic. Lawrence, thanks a lot for having me. Really enjoyed it. Thanks a lot.
Thank you.